All right, good morning, everybody. I'm Senator George Barker, representing parts of Northern Virginia here, parts of Alexandria, Fairfax, and Prince William County. This is one of 4 virtual regional hearings on the state budget being held all across the Commonwealth today by the Senate Finance and Appropriations and the House Appropriations Committees. Each year, the committees are required by law to hold a series of public hearings on the governor's proposed budget to give all of you, the citizens of Virginia, the opportunity to comment on specific issues of concern to you. Today is your opportunity to talk, and our job as legislators is to listen to you. Let me take a moment before we begin to have the other legislators with us today introduce themselves. Staff will call out your name, and then you may state your name and the district you represent.
Starting off, Senator Vogel. She may have stepped away, so Senator Marston.
She's there.
Yeah.
Yeah, but she needs to
unmute. Yeah.
Now she may be frozen.
Yeah.
Yeah. So Senator Marston, you want to?
Thank you so much. I'm Senator Dave Marsden, and with the 37th District, which is entirely within the bounds of Fairfax County. And on the Senate Finance Committee, I chair the subcommittee on economic development and natural resources.
Senator Eben.
Adam Eben, representing Alexandria, Arlington, and Fairfax in the Senate.
Moving to the House side, Delegate Torian.
Yes, Delegate Luke Torian, representing the 52nd House District in Prince William County.
Delegate Sickles.
Good morning. I'm Mark Sickles, representing the 43rd District of Fairfax County, which runs from the Alexandria city line down to Lorton.
Delegate Plum.
Good morning. I'm Delegate Ken Plum. I represent the old 36th District, soon to be the 7th District. That's primarily Reston, parts of Herndon.
Delegate Bulova.
Good morning, everybody. I am David Bulova. I represent the 37th House District, which includes the city of Fairfax, George Mason University, and areas around Centerville.
Delegate Krizik.
Good morning, everyone. My name is Paul Krizak. I am the delegate that represents the Mount Vernon and Franconia magisterial districts of southeastern Fairfax County.
Delegate Reed.
Good morning, everyone. I'm Delegate David Reed, and I represent the 32nd District, which is the eastern portion of Loudoun County.
Now we'll go back to Senator Vogel.
Good morning, Mike. Good morning, everybody. I'm Senator Jill Vogel, and I represent the 27th State Senate District, which is the northwestern part of Virginia, includes Winchester and Frederick, Clark, Fauquier, a little bit of Culpeper, a little bit of Stafford, and a part of Loudoun County. And I fixed my screen. I was trying to play with my background, and then I froze myself. And since when did you ever start with the V's, by the way? So thank you for that. There's a first time for everything. And I'm happy to be here and see all of my colleagues and happy to hear all the testimony this morning. So thank you.
Certainly. All right.
All the members present. If I missed anybody, just speak up.
I think you got them all. So
great. Thank you, Senator Barker.
All right. I'm going to start out with a few simple ground rules that will help our hearing today go smoothly and at the same time give everyone the opportunity to be heard in a reasonable amount of time. First, when you signed up to speak, you received an email with a Zoom link for the hearing. As of this morning, the House Appropriations and Senate Finance and Appropriations Committee websites were updated to include a listing of each speaker who signed up to speak, along with a number. That's the order in which you speak. Staff will, from time to time, call out those numbers along with the name from the sign-up list to give you an idea of how far we are down the list. If you are not present at your time to speak, for whatever reason, then you will be allowed to speak at the end if you are present in the Zoom meeting at that time. As we get closer to your number, staff will move you from the waiting area into the actual meeting room so that you can speak. However, please do not speak until your name is called. Remember to unmute yourself as soon as your name is called to minimize transition time. Please limit your remarks to 3 minutes or less. That way, we can all be heard in a reasonable amount of time and no one will be left out. We will stay in the meeting until the last speaker that had signed up has had the opportunity to be heard. Please remember, near the end of your 3 minutes, a timer will sound. Please wrap up your comments at that time. After you have completed speaking, staff will move you back into the waiting area where you can continue to watch the hearing or leave altogether. Finally, to hear as many issues as possible and to be respectful of the time of others in the audience, we ask that you avoid duplication when testifying. I can tell you from years of experience that repeating the same testimony on the same issue can be counterproductive. If there are several people speaking from the same group, we encourage you to have one spokesperson. You can always mention how many other members of your group are listening to show your group's support for your cause. Not only does that save time for everyone, but it's much more effective when making your case. That's pretty much it. We're glad to be here, and I hope that each of us will learn something new today, something that we hadn't thought about before. That's a big reason why we're here. Now, staff will call out the first speaker, who is number 1 on the list.
Thank you, Senator Barker. So the first speaker is Elizabeth Clark, who actually has a pre-recorded video. So if you bear with me for a moment, I will share my screen to play the video, and when it's done, I'll unshare. Just give me a second.
Hi, I am Elizabeth Clark. People with ID like me are like you. We want to be included like you. We want to be good citizens like you. We want to have friends like you. We want to share our gifts like you. We want to be in the community like you. We want to go to college like you. We want to work with people like you. But we need support. We don't want to do nothing all day. The Blockade River house people with ID. I have been waiting for almost 10 years with over 14,000 in Virginia for Blockade River. Please don't make us wait longer. Will you show us you care? Please help us have good lives. Please support the Blockade River and end the faithless. Thank you. I am Elizabeth Clark.
All right, Mike, you're muted.
Yeah, sorry about that. Small technology problem. The second speaker is Susanna Taylor.
Good morning, members of the General Assembly. My name is Susanna Clark Taylor, and I live in Winchester, Virginia. My daughter Isabel is 11 years old, and she has CHARGE syndrome, which includes multisensory impairment, such as blindness and deafness, as well as overall cognitive developmental delay. She also has Lennox-Gastaut syndrome, which is a very rare and very severe form of childhood epilepsy involving multiple types of seizures that are extremely difficult to treat. The severity of my daughter's needs makes it nearly impossible for me to be gainfully employed outside of my home and to still be on call for my daughter 24 hours a day. At last year's budget hearings, I had the privilege of advocating that a budget amendment be passed allowing parents of minors with disabilities to be their own child's paid personal care attendant. That budget amendment was passed, and I cannot thank you enough for listening to the concerns of so many Virginia parents who were in dire need of this important support. It has made an enormous difference to all of us. I am so grateful that Isabel qualifies for the CCC Plus waiver. I don't know what our family would do without it, but she won't always be a child, and I must plan for her future. In less than a decade, she will need DD waiver services so that she can continue to learn new skills, gain access to her community, and receive residential support. But currently, like Elizabeth Clark said before me, there are over 14,000 people waiting for a DD waiver in the Commonwealth of Virginia. Isabel is just one of them. Yes, at 11 years old, it is already necessary for her to be on the waiting list. Please support funding the additional 500 waivers recommended by Governor Youngkin that will bring a total of 1,100 new waivers effective July 1st, 2023. It is not nearly enough to serve everyone in need, but to those 1,100 people who were once children with disabilities like my daughter Isabel, but who are now adults with disabilities, those waivers will make all the difference in the world. Additionally, it is extremely important that Virginia have a skilled workforce to serve children and adults with developmental disabilities. With the severe workforce shortage, Virginia needs to develop creative approaches so that the general public is aware of the job opportunities and that those jobs pay a livable wage so that we are not losing interested and qualified personnel to other industries. In short, please support the ARC of Virginia's legislative agenda so that Virginia's most vulnerable citizens like Isabel are not neglected and have the supports they need to live meaningful lives both now and far into the future. Thank you.
The next speaker is David Broder.
Yes, good morning. My name is David Broder, and I serve as the president of SEIU Virginia 512, a union of essential home care and public service workers. I'm also the dad of two amazing public school students, a Fairfax County resident, and a proud taxpayer. I'm here today to ask you to invest in quality home care, in quality public services, and in good union jobs for all Virginians. I think we can all recognize that working people are the reason that we have gotten through the worst of the pandemic. Home care workers and nurses, health department staff and first responders, educators, grocery store employees, janitors, and so many others are the true heroes. And in recent years, we've worked with you, the General Assembly, and together we have taken steps to support and empower working people. I want to thank you for your votes to expand healthcare for working Virginians under Medicaid, to raise the minimum wage, to pass hazard pay and overtime pay for care workers, and to repeal the ban on collective bargaining for county and city workers. These measures have saved lives, supported families, boosted our economy, and they've proven overwhelmingly popular. In our region alone, Arlington, Alexandria, Fairfax, Loudoun, and Prince William have all passed collective bargaining rights so that their employees have a seat at the table and to give the counties a leg up in recruiting and retention. And yet we also acknowledge that too many working Virginians continue to struggle. Low wages and the lack of basic protections and benefits for many workers, disproportionately Black and brown women, have resulted in a crisis. The care crisis with older adults and people with disabilities unable to hire home care workers because the pay is too low is just one example of how the inequities in our economy hurt us all. That's why we must act. And this session, we're asking you to prioritize working families in the state budget, to fund 10% rate increases and 10 days of paid leave for home care workers, to restore respite hours and end the waiver waiting list for people with disabilities, older adults, and their families, to fund essential local government services and employees, and to ensure that all workers have a living wage, paid leave, healthcare, and a voice on the job. Ultimately, we know the best way to invest in working people is to empower them to have a seat at the bargaining table to negotiate for the pay, benefits, and working conditions we all deserve. And so in the year ahead, let's work together to ensure that every Virginian has the right to join a union and collectively bargain if they so choose. You and your colleagues around the state today will hear from a few SEIU members who will share their personal stories, their challenges, and their hopes for the future. Thank you for taking the time to listen today, and thank you for then taking action to make sure that Virginia is the best state for working families.
The next speaker is Ann Whipple.
Good morning. I'm just getting over COVID, so I hope I'm not too croaky, but thank you for having me. I'm Ann Whipple, an at-large representative of the Fairfax Falls Church Community Services Board, the largest CSB in Virginia. We serve residents in Fairfax County and the cities of Fairfax and Falls Church, reaching over 20,000 individuals with challenges related to mental health, substance use disorder, and developmental disabilities. On behalf of the CSB Board, I request your support for the 500 new developmental disability waiver slots to address the gap between those who need waivers and those who have access to them. I also ask that you support funding increases for Virginia's behavioral health system. The CSB Board is grateful for the governor's $230 million behavioral health plan, as it includes needed investments to begin addressing gaps in how the state cares for those with behavioral health needs. However, with the behavioral health system in crisis, sufficient state support is vital if CSBs are to meet state-mandated requirements, as well as increase community needs. We look forward to working with you to enhance community capacity, and we ask that you consider specifically this additional funding now. Investments to address the CSB workforce crisis and improve recruitment and retention through CSB staff pay increases and loan repayment programs. The pandemic only exacerbated the significant workforce crisis in behavioral health and developmental disability services. Vacancies at the CSB hit a high of 206 positions in FY 2022. And we've all got to remember that if we can't improve workforce capacity, we won't be able to implement expanded services. Regional funding to help address the state psychiatric hospital bed crisis. While Fairfax County continues making local investments in behavioral health services to help ensure one of the lowest per capita hospitalization rates in the Commonwealth, rates could be even lower with additional state funding. Ideas to increase Region 2 community capacity include funding for a 24/7 specialized 8-bed residential program, 2 homes to serve those with behavioral health needs, 2 secure 8-bed units to serve individuals adjudicated not guilty by reason of insanity who are on the extraordinary barrier to discharge list. And last, funding to address the historical shortfall for state-mandated services like STEP Virginia. For STEP Virginia, the state has not provided adequate funding for the CSBs to implement the 9 state-mandated services. As of now, the STEP Virginia shortfall for Fairfax Falls Church is over $23 million. Thank you for your time, and as always, for your continued support.
The fifth speaker is Angela Wider.
Hey, good morning. Thank you for taking my testimony and the testimonies from numerous advocates in the behavioral health and developmental disability community today. My name is Angela Wider. I am the past board chair for the Virginia Association of Community Service Boards and the Loudoun County Community Service Board. I am here to speak to the needs of individuals with behavioral health conditions and developmental disabilities. And thank you, Ann, for your comments, and I support you wholeheartedly. The VACSB is grateful for the governor's budget initiatives related to our system. The governor's introduced budget does not, however, contain any direct funding for workforce initiatives targeted at the public behavioral health and developmental disability system. Therefore, the VACSB is requesting a budget amendment of $162.6 million in one-time funding in FY24 to provide quarterly recruitment and retention bonuses, for direct care staff at CSBs. VACSB plans to use this stabilization strategy in FY24 and will request a rate increase to address staffing in the next biennial budget. Please note that CSBs need an investment in all areas of their direct care workforce. For example, we support the additional funding for developmental disabilities waivers in the governor's budget. However, the vacancy rate for the support coordination staff that initiates and manages these waiver services remain high and must be addressed in order for CSB staff to handle the additional work involved with each new waiver. Also, the governor's funds to expand crisis services is critical, but keep in mind that the CSBs are already struggling to fully staff some of their crisis programs. Please consider funding VSCSB's two other budget requests. One, addressing inflation pressures in STEP VA services. Funding for the initial steps of STEP VA has remained level since inception. Therefore, VACSB is requesting $8.7 million in ongoing funds to account for inflation increases that have occurred since these steps were first funded. These steps are same-day access, primary care screening, and outpatient services. Number two, bridging the gap to retail cannabis sales. The VACSB is requesting $2.5 million for CSC prevention staff to begin implementing underage cannabis use prevention campaigns. CSBs are slated to receive a portion, of the revenue from cannabis sales once retail is open. But with retail sales on hold, CSBs cannot assess the critical funding stream. Again, we appreciate the funds in the governor's budget for behavioral health and developmental disabilities, but hope the General Assembly will also make a significant investment in the CSB workforce. Thank you and Happy New Year to you all.
The next speaker is Donna Burnett. Donna, if you could unmute yourself and so Donna Burnett, if you could unmute yourself and begin your speaking. Well, we'll hold on for her for the second. The next speaker would be Rena Bumbray Graves.
Good morning. My name is Renee Bumbray Graves. I'm a home care worker from Woodbridge, Virginia. I'm a proud member of the union SEIU Virginia 512. I'm also here today to speak in support of quality home care for all Virginians and good union jobs for all home care workers. Home care workers like me provide essential care to older adults and people with disabilities, keeping them healthy and safe at home. We save the state money and keep Medicaid costs down by keeping people out of nursing homes and emergency rooms. The pandemic has proven the importance of our work. I have been a home care worker all of my life. I take care of my adopted sister, Leah, who has spina bifida and cerebral palsy and is also paralyzed on one side of her body. My job is to make sure that Leah's needs are met daily so that she stays healthy and independent and can live a life like yours with dignity. I'm honored to carry on the tradition of Black women caregivers. Many home care workers to this day are mostly Black, Brown, API, and immigrant women. Also, a lot of males have become home care workers as well. Together, the General Assembly and care workers have taken important steps in recent years to improve the quality of care in Virginia. Thank you for supporting raises, paid leave, hazard paid, and waiver slots. By investing in home care during the pandemic, you kept people out of nursing homes and saved lives. Nonetheless, right now we face a care crisis. Inflation and the lack of full benefits make it nearly impossible for me to survive as a home care worker. They also make it nearly impossible for Leah and other consumers to find the care that they need. This care crisis is only going to get worse unless we take decisive action. That's why I'm asking you, the General Assembly, to make a priority of the following items in this year's budget. Please fund 10% raises for home care workers, even though we need more than that. Please fund 10 days of paid leave for every home care worker and every worker. And please restore the respite care hours that Virginia families rely on to 720 hours per year. Funding raises, paid leave, and respite hours are an important step towards addressing the care crisis. Ultimately, though, home care workers like me need a seat at the table through collective bargaining. Only then can we ensure that Virginia has the quality home care system we all deserve. Thank you for listening to me and to my fellow SEI care workers today, as well as the families and people we help care for. We all look forward to working with you in Richmond this session. Thank you. Have a great day.
Donna Burnett, are you able to speak now? Well, we'll keep checking with her. So the next speaker would be Pam Spearing.
Good morning. My sister is actually Donna Burnett, and she is on, but having trouble with her microphone, so she'll keep working on that.
Okay.
Anyway, I wanted to tell you about my 32-year-old son, Jamie. He was adopted at age 1 with fetal alcohol spectrum disorder and an intellectual disability. We have lived in Loudoun County all of our lives. He's an avid sports fan and an athlete with Special Olympics. He, this year, has the honor of being chosen as a Virginia Special Olympics Global Messenger, spreading the message of inclusion. He's been a proud employee of Costco for 14 years. He receives DD waiver services so that he can remain as independent as possible. The services assist with managing his finances, activities of daily living like cleaning and cooking, managing his behaviors, and monitoring his physical and mental health. Jamie also receives a monthly SSDI benefit. This year, my husband retired, and Jamie became eligible for an increase in his SSDI benefit based on my husband's earnings. Jamie needed to reduce his Costco hours to 8 hours a week because of the DD waiver income cap. Upon my husband's death, Jamie will receive another increase in benefits that will force him to quit work completely. Jamie cannot refuse the SSDI benefit. So not only will he lose a parent, he'll also lose his job. Many others like Jamie are experiencing forced unemployment, reduction in hours, or an inability to take a higher paying job, keeping them below the poverty level for this same reason. Please support the ARC's legislative agenda, which includes allowing DD waiver users to enroll in Medicaid Works. That would mean that people could keep working, pay into Medicaid, and maintain their waiver. It would enable people to keep working, maximize independence, and not lose life-saving support through their waiver. Without this fix, my son and many other sons will be at home, unable to work, needing more support instead of less for the remainder of their lives, possibly another 30 to 50 years. A parent's greatest fear and what keeps them up at night is the future of their loved ones. Their future should include the dignity of employment as a contributing member of their community. Thank you.
Donna Burnett, I don't know if you've been able to fix your microphone or not.
Sir, Donna is standing right here. Would you mind if she just takes my seat and shares?
Go ahead.
We have quite the family. Two of us. This is Brett's story. I'm Donna Burnett. I'm here in hopes of preventing my son's suicide. Let me tell you why I make that statement. It's really my story, what keeps me up at night. Brett needs the DD waiver once I'm gone. His services include supported employment at Echo. His identity is tied to work. Like us all, isn't one of the first questions you get asked or asked is, where do you work? I know where you all work, but that is a standard question that does get asked. You see, he has demyelination of the brain, a physical disability. This resulted in developmental impairment. He functions cognitively at about a second grade level. He has twice mentioned thinking about committing suicide. The first time was when he couldn't drive. He saw his sisters and cousins being able to drive. At a second grade cognitive level, it just didn't work. He was devastated. The second time, when he could not live independently, he had too much anxiety, and so we had to bring him back home. Again, a second blow. Again, the thought of suicide. His independence now comes from working at Echo. He mows lawns at FYA with assistance. The DD waiver support is critical from him to work, and this is his identity right now. If he loses the DD waiver services when I die, due to the increase in SSDDI benefit, he not only loses his parent, but he loses his job. And it's at that moment I fear the most. He will have no reason to live. Work is his life now, his stability, his pride in himself. So please support the ARC's legislative agenda, which includes allowing DD waiver users to enroll in Medicaid works. It would mean that people could keep working, paying into Medicaid, and maintaining their own DD waiver. It would enable my son to keep working at a critical transition in his life after the loss of his parent. You hold the future, his future, in your hands. I am trusting you to keep that uppermost in your mind, and I thank you for it. Respectfully, Donna Burnett.
Now, the next speaker is number 9, Patricia Morrissey.
Good morning. I'm Patty Morrissey. I'm from Loudoun County. I am the chair of the Loudoun County Community Services Board. In a few minutes, our vice chair, Julia Richardson, will speak to you about our budget requirement for a crisis receiving and stabilization facility and give you details on that. That will serve Northern Virginia and Region 2, and it'll enable us to take a huge leap forward in providing our citizens with greater access to both public and private mental health care resources. But I'm going to focus specifically this morning on an issue you're all painfully aware of, and that is the workforce shortfalls across the behavioral health fields. Recent studies that I'm sure to one extent or another you have all been briefed into documented the crisis in both the ability of the public and private behavioral health organizations to fill positions and even to retain already trained staff. Every day this problem continues, it worsens because people quit from exhaustion and frustration. We believe the governor's budget will help retain current staff and help mitigate the current crisis, but we need a permanent mechanism for increasing the number of people entering the behavioral health fields, and particularly in committing to the public system. Loudoun County and Northern Virginia CSBs request that the Virginia Department of Behavioral Health and Developmental Services create a full-time regional projects officer in Region 2 that will enhance the workforce education, training, and recruitment, and to enable us to collaborate on a regular basis with our academic resources to enhance the workforce pipeline. The development of a workforce pipeline will enable CSBs to attract talent through academic institutions by managing internship programs in the public system, enhancing the paraprofessional career tracks within behavioral health and developmental services fields, with the goal of increasing individuals securing a license in Virginia. This position is fundamental to CSB's ability to increase interest in and pathways into the behavioral health fields. And I'm tried to do a very specific testimony today to get you to focus on that. But I also want to mention that the developmental disability community has been speaking today is obviously part of our portfolio, and we fully support what they're after and to address the huge gaps in the services to their community. So I thank you all for your public service and for listening to my testimony today.
Next speaker, number 10, Tammy Wandong Ware. I received a message that she could not attend. So the next person is number 11, Mark Albert, who is not in attendance yet. So we'll check back with him at the end. So the next speaker would be number 12, Michael Thomas.
Good morning. My name is Michael Thomas, and my wife Karen and I are the proud parents of Drew Thomas. Drew will turn 31 tomorrow on January the 6th. He has severe intellectual and cognitive disabilities. He has impaired vision and hearing, seizure disorder, and is nonverbal. All of this manifested as self-injurious behavior and strongly impacts who Drew is today. That brings me to the issue I'm here to address today. There's a lack of provider capacity. Drew is supported in his group home and day program by a core group of dedicated, hardworking staff that treat our son with dignity and respect. The staff are essential to addressing his needs. Drew requires a one-on-one level of support at home and in the community, as well as during overnight hours to maintain his health and safety. Staff must be close by so they can immediately intervene if he engages in self-injurious behavior. At times, there have been challenges due to the lack of staff. This has occurred largely because of staff turnover, as they have found better paying jobs. This can result in sometimes having just an unfamiliar body to fill in. And this type of situation is unacceptable for my son and truly jeopardizes his safety. Most providers lack the support and resources to build or expand their business models to meet the demands for community services. All providers struggle to attract and retain an adequate qualified workforce. Therefore, I'm asking your support for the following possible solutions to stimulate provider businesses through innovation. They include the following: add to the funding by paying our direct care staff at 75% of the average wage for direct care staff nationally, as proposed by Virginia Access. Match support living rate to smallest group home rate so that people have an opportunity to live in smaller, customized homes where we often see a decrease in behavior. Third, create a workforce development and recruitment campaign that Drew and others will always have a dedicated and qualified support staff that treats them with respect and dignity, keeping them safe and addressing their needs. I thank you for your time and opportunity to speak to you this morning and look forward to working with you. Thank you.
The next speaker, number 13, will be James Vollmer. We're having a slight issue promoting him to speak, so we'll keep working on that so that he knows that. So the next speaker will be Carol Skelly.
Good morning, distinguished senators and delegates. I am speaking in support of the ARC of Virginia's recommendations for Virginians with developmental disabilities. The DD community very much appreciates recent initiatives from the governor and members of the General Assembly to address the Priority 1 waiting list for developmental disabilities, the DD or Medicaid, the DD Medicaid waiver. Priority 1 includes individuals with serious health and safety issues. Many of them are in crisis. Please support the budget amendment submitted by Senator Donovan to eliminate the Priority 1 waiting list over the next 2 years. The Department of Justice settlement agreement was signed in 2011 and was supposed to end after 10 years. It remains in force because Virginia has not made a successful transition to best practice individualized services. In 2016, after 5 years of study, a number of new best practice supports were approved for DD waiver holders. However, today, these services exist mainly on paper and not in practice. Fewer than 3% of waiver holders have been able to access them. Service providers do not offer them because they are not adequately funded. And because they're not generally offered, the professionals helping with service delivery are not familiar with them, and families do not know that they exist. The single most problematic rate is for the service called supportive living, which is an alternative residential support to traditional group homes. Nearly all of the DD waivers that you have provided in recent years offer supportive living rather than group homes as their primary residential option. The problem is that the supportive living waiver rate is 1/3 lower than the group home rate, making it virtually impossible to use. We are asking for a budget increase of $1 million this session to equalize these rates and make supportive living a viable service. The ARC is also proposing some one-time expenditures for implementation and outreach around those unused 2016 services. I urge you to look carefully at these proposals as a strategic investment in improving services to Virginians with developmental disabilities. And I also want to support the comments of the previous speaker, Michael Thomas. I also have a son with severe autism and ID with a history of behavior issues who lives in a group home. And I agree that, that we need initiatives to improve staff support and care in those homes, very much as he described. Thank you very much for your attention and for all of your efforts in our behalf.
The next speaker is number 15, Julia Richardson.
I'm here. Good morning, General Assembly members. Thank you for having me. I'm Julia Richardson. I am coming as a resident of Loudoun County, but also a licensed clinical social worker. And as Patty Morrissey said, I'm the vice chair of the Loudoun CSB. We are the citizen board of the Loudoun Department of Mental Health, Substance Use and Developmental Services. And I group those services kind of under one thing as calling them behavioral health, even though that's very broad. As you know, each locality in our state has access to a CSB, and we provide a broad safety net of the most essential behavioral health services. You've heard about some of them today. Access to those developmental disability waivers. Crisis services are the most obviously life-saving and life-sustaining of those services. And I know you've heard about some family members of people who've testified today. I would like to encourage you to think of a person that you know or love who has struggled with mental health, problematic substance use, and intellectual developmental disability, and keep that person in mind as you hear testimony and process what you've heard today. I'm here today expressing our enthusiastic support for Governor Youngkin's funding of the critical behavioral health services across the Commonwealth in this proposed budget. The investment will really help our neighbors and loved ones, those people that have mental health, behavioral health needs, both in short and long term. And specifically, I'm coming to advocate for a need that we have in Loudoun County for funding to build a physical location for a crisis receiving center. I'm requesting priority consideration for this, as the governor specifically mentioned these centers in his priorities, and it is a linchpin, a fundamental piece of our revolutionizing behavioral health and preventing and addressing crisis resources as a whole. So a physical building would be serving as a home base for anybody, family, individuals, as well as law enforcement who need to urgently access the broad range of services that the Loudoun Department of Mental Health, Substance Use, and Developmental Services provides. And at a crisis receiving center, community members come in. Some of them might be accompanied by law enforcement, and they would be able to get a screening, an assessment, something to eat, change of clothes, and get linked to the broad amount of resources that we have. But it's one place to go. It's a physical space. And hopefully that would eliminate the need for a hospital emergency room for a lot of these individuals coming in. To build this center, we're requesting one-time funding of $16.1 million. This would fund the construction, design, and equipment costs just to build out the facility. And it would include a law enforcement drop-off crisis location within the facility separate for the law enforcement. This capacity inside this facility is described in recliners, which is a strange, odd term, but it's basically comfortable spaces for a person who would have an up to 23-hour assessment. So they're not hurried in, they're not hurried out. This is a long-term, ongoing crisis stabilization intervention. It's not a simple assessment and referral. This is a comprehensive thing, and it's really broad what it could serve. We would have capacity for 10 recliners for youth, 16 for adults, and 10 beds or short-term crisis stabilization places to stay for 24-hour service for several days or weeks. All of these hopefully would be diverting individuals away from our emergency rooms and from our inpatient psychiatric hospitals, clearing space and capacity for those that really do need that high level of care, and alleviating the bed shortage here in Northern Virginia. It would also dramatically improve law enforcement workload and cohesiveness with our law enforcement, better serve our community who are in crisis. If we receive this funding and all the other funding from the projects you've heard about for the crisis receiving centers and crisis programs, then our program still, our region still would not be at the SAMHSA, the Substance Abuse Mental Health Federal Crisis Now standard. We would have about 76% of the standard in short-term crisis beds, about 68% of the standard in 23-hour recliners, and for our population. So I just want to point out that even if we receive all of the funding that each of the region CSPs has asked for in terms of crisis services, we still would not be meeting the standard that the state has given us for the Crisis Now model coming from the federal government, the SAMHSA. Please keep in mind the people that you've experienced in your life, that you know and love, who've experienced crises and substance use, developmental disabilities, struggled, and think about how such a facility might have served them or would serve them in the future in the time of crisis. We hope to get our funding and build the facility out for the community for the years ahead. Thank you for hearing my testimony and for advocating for our community.
James Vollmer, if you can hear me, you might be able to speak and we can hear you in audio.
Yes, I can hear you.
Okay, we just don't have the video, but we worked it out so we can at least hear you.
Okay. Can you hear me now? No?
Yes, we can.
You can?
Yes.
Okay, great. Hi, my name's James Vollmer. I live at 12804 Rexham Road in Herndon, Virginia, and I'm a member of SEU Virginia 512. I'm here today to share my insights about the needs of caregiving services in Virginia. A special shout out to Delegate Ken Plum. I'm a retired federal employee, and I was able to provide home care services to my niece Kelly for 6 years after her mother, my sister, died unexpectedly from a heart attack. She is now living in an adult care setting in a community facility with 3 other disabled individuals. Her dad can take Kelly home once a week for up to 24 hours, which is a blessing to them both. Now, Kelly has cerebral palsy. She cannot walk or talk or toilet herself, but understands everything, and she's the happiest person I know. Kelly had to wait 6 years on the disability waiver slot list before she could qualify to get caregiver services under the state budget. After her mother passed unexpectedly from a heart attack, I took over caregiver services. I helped Kelly in all aspects of her life, including dressing, feeding, and changing her, and giving her medications prescribed by her doctor. With my help, Kelly's dad could work. Kelly is fortunate to have caregiver services. Unfortunately, we are not making enough progress in providing caregiver services to our elderly and disabled people in Virginia. There are now about 13,000 people on the disability waiver slot list waiting an average of around 10 years before getting state funding for caregiver services they need. That's why I'm asking the state budget to substantially reduce the disability waiver slot backlog, provide at least $15 an hour to home care workers statewide, approve a 10% raise for home care workers, expand paid sick leave benefits to 10 days, to restore the 720 hours of respite care that Virginia families rely on and are essential for families to thrive. In summary, funding disability waiver slot backlogs, raises, paid leave, and respite hours are important steps toward eliminating the caregiver services in Virginia. Ultimately, though, home care workers need a seat at the table through collective bargaining to ensure that Virginia has quality home care system we all deserve. Eliminate the dealer discount sales tax loophole to add about over $100 million a year in state revenues to help pay for some of these recommendations. Thank you. We look forward to working with you in Richmond this session.
The next speaker is number 16, Catherine Montgomery.
Good morning, senators and delegates. My name is Catherine Montgomery. I was on the DD waiver waitlist since 2016. I was recently able to get off the waitlist and actually receive a DD waiver. I've been on for 2 years. For that, I am grateful. I rely on my waiver for my caregivers. They help me have a great life, which includes volunteering, working, and rescuing dogs, and just being part of my community. A couple of years ago, I was hired as a DD waiver peer mentor. That means that I help other waiver users get advice and ideas on how to use their waiver services, especially the newer services. They're more inclusive, but not many people know about them or how to make them work for them. In 2022, you gave DD waivers a much needed rate increase. Thank you. However, there was only one direct care service that didn't get the proposed funding increase, peer mentoring. I'm here today to ask you to support the ARC of Virginia's 2023 legislative agenda and fund that increase now. We peer mentors are working hard and want to keep working to help others like me. Please help me help others. Thank you.
The next speaker is number 17, Sarah Blankowski.
Good morning, legislators and fellow advocates. Hi, my name is Sarah Blankowski. I live in Fredericksburg, Virginia. I'm a home care worker, mother of a daughter with Down syndrome and autism, taxpayer, voter, and honored to be a union member with SEIU Virginia 512. I'm here to speak in support of quality home care for older adults and people with disabilities and good union jobs for home care workers. Virginia taxpayers funding Virginia jobs, taking care of Virginia's precious loved ones. I have been my daughter's primary caregiver since she was born in March of 2006. I have been one of her paid home care providers since July of 2020, when the Virginia legislature generously allowed parents of minors to be paid providers. I am incredibly grateful for the emergency authorization and many home care provider parents who encountered similar situations. My daughter Josie is 16, has Down syndrome and autism, dementia at times, and complex medical conditions that include obstructive sleep apnea, infectious asthma, long-haul COVID, hip challenges, low motor tone, and behavioral challenges that include obsessive compulsive behaviors, sensory integration challenges, elopement, and occasional echolala. As the primary home care worker for Josie, I manage all of her appointments, medications, breathing treatments, B12 injection shots, and I also ensure that her personal hygiene is followed and not missed, including bathing, showering, cutting her nails, helping her with Band-Aids, and also shopping, preparing, and organizing her dietary meals and needs. I also homeschool her due to school germs and viruses. They're too rough on her. Personally, I've lost jobs due to her hospitalizations. I've had to design my life around her medical needs. Home care work helps us pay for her many needs not covered by both our primary and secondary Medicaid insurance. It allows us to use our taxpayers' dollars raised by our other jobs to help take care of Josie. I also work part-time. We are incredibly grateful. So many more folks need home care workers. They struggle to hire and retain home care workers, and home care workers are incredibly in-demand jobs, and there are not enough folks to fill the job openings. That's why I'm asking the General Assembly wholeheartedly to fund the following items in this year's budget. 10% raises for home care workers, 10 days of paid leave for every home care worker. Restore the 720 home care respite hours that Virginia families rely on. Funding raises, paid leave, and respite hours are important to helping ameliorate the care crisis. Home care workers like me need a seat at the table through collective bargaining. Virginia taxpayers funding Virginia jobs, taking care of Virginia's precious loved ones. Thank you very much.
The next speaker is number 18, Kelly Lang.
Give me the time to address you all today. I'm Kelly Lang and have lived in Leesburg for over 20 years. My daughter and I both sustained brain injuries resulting from a horrific car accident in 2001. Her injuries were life-threatening, but luckily, due to the quick response of the first responders and hospital staff, her life was saved. We both suffered long-term impacts of this accident. My husband and I started advocating for her and our family the moment we arrived at the hospital and continue today, 21 years later. We recently published a book chronicling our story of perseverance, advocacy, and hope. As a result of all this work, I have become a brain injury advocate and subject matter expert for all those living with the consequences of brain injury. My daughter receives case management through Brain Injury Services, the ARC of Northern Virginia, and Moms in Motion. We have been involved with the Brain Injury Association of Virginia since 2002. And without all these organizations and support, I do not know where we would be today. They've provided essential resources, referrals, and support during our times of struggle and transition. I'm joining the Brain Injury Association of Virginia this year and asking the General Assembly to invest in the brain injury community. Without these, our community members will suffer. Brain injury causes significant financial constraints for families. Many services are not covered fully by health insurance, if they're covered at all. In addition, a number of caregivers are forced to leave their jobs in order to care for their loved one or reduce their work hours, resulting in a loss of significant income. I know this hardship personally. I could no longer work following our accident due to my injury and caregiving role. Specialized community-based brain injury case management services are lacking in many areas of the state. I am asking all of you to authorize the expansion of these services. Families experience so much grief and loss, and they need the case management services to help them navigate the web of care once their loved one exits the hospital system. Most leave acute or rehab hospitals without any guidance. Their loved ones are forced to circumnavigate the overwhelming task of finding appropriate providers on their own. It is a huge strain on these families. These services are not once and done. They are needed throughout the lifespan. Housing has been known to be one of the primary social detriments of health. We have looked for programs where our daughter can learn independent living skills in a safe environment. Her high school transition teacher secured a spot for her in the Woodrow Wilson post-secondary transition program. This gave her some insight into the skills she will need to become independent. Community brain injury programs need staff to work with local housing entities, represent the needs of the brain injury groups in housing-related conversations, and work to maintain housing supports and/or related independent living skills to ensure their safety. Many brain injury organizations have seen an increase in the number of calls about housing assistance. Despite facing some of the same needs as those with individual and developmental disabilities, people with brain injury have little or no service options. The housing needs of those with brain injury can be more complicated due to the exact nature of their injury. Thank you for allowing me to address you today.
The next speaker is number 19, Dr. Julius Reynolds.
Good morning, members of the House Appropriations and Senate Finance. My name is Dr. Julius Reynolds, and me and my family live in Ashburn, Virginia. I work as a juvenile probation officer for Loudoun County and have worked in public service for well over 30 years. Some of those years were done in Fairfax under Senator Marsden, who at the Fairfax County Juvenile Detention Center about 30 years ago. He may not remember, but it was my first employment into the juvenile justice system. I'm a proud SEIU Virginia 512 union member and honored to serve as the chair of SEIU's Loudoun County chapter. I'm here today to speak in support of funding quality public services and good union jobs for all Virginians in order to advance economic and racial justice in our Commonwealth. Throughout the pandemic, essential public service workers like me and my colleagues have been on the front lines of keeping our communities healthy and safe. We have provided essential health care, child care, transportation, sanitation, mental health services, and so much more. And yet, hardworking Virginia families are struggling. The high cost of living, the lack of support on the job, the legacy of Jim Crow and anti-worker laws, and more have created a crisis for working people. Together, we have made progress in recent years. Thank you for your votes to expand collective bargaining rights, to fight wage theft, and to raise the minimum wage. Your actions have had tremendous consequences. In Loudoun County, we have proudly passed a meaningful collective bargaining ordinance for frontline county employees and firefighters. My coworkers and I look forward to getting to the bargaining table this year to negotiate for big, bold improvements for workers and workers' families throughout our community. Yet, I'm mindful that so many other hardworking Virginians, including the home care we heard from today, are still denied the right to collectively bargain. That's why we must continue to take bold action to support working families, create good union jobs, and strengthen our economy. I'm here to ask you to prioritize the following items in this year's budget. Please fund local government services provided by county employees like me and my coworkers. Please fund quality home care for people with disabilities, older adults and families, and their care workers, home care workers, as you have heard my fellow SEIU members speak so powerfully about earlier. And please fund good union jobs and paid leave for all workers. My coworkers and I work hard to serve our community. In return, we deserve a living wage, strong benefits, and a seat at the bargaining table. That's what everyone deserves. That's what Unions for All is all about. Thank you for listening today. We look forward to working with you in Richmond this session to keep our communities healthy and safe and to build an economy that works for everyone. Thank you.
Next speaker is number 20, Christina Nickel. Hopefully I got that right.
Hi, this is Karen Smith. I am speaking on behalf of Christina and myself. I'm speaker number 20. And we took the advice of Senator Barker so that we don't repeat ourselves. I'm the executive director of the ARC of Greater Prince William, and I would like to personally and as an agency thank each and every one of you for the significant impact that you've had on our agency this year by providing additional rates for the Medicaid waiver. It has been significant, and we as an agency, and I believe most agencies have done the same, put that extra money that we have gotten to our direct care professionals so that we can raise their rate of pay, and also our LPNs. We specialize in supporting people with medical disabilities who have also developmental disabilities and intellectual disabilities. And I can't tell you enough how pleased our staff is that they have gotten that raise. But unfortunately, we still have a work crisis in our agency and across all providers. We still aren't able to attract people to make this a profession to supporting people with developmental disabilities. Because of inflation and our economic situation in the state and in the nation, we still have a crisis. And I'm hoping that in the next biennium, we will, on a routine basis, raise the rates so that we keep up with inflation and other things happening in just our economic situation and not have to wait year upon year like we did this last time. But thank you very much. And as what was stated previously, one of the rates that did not get raised was the supported living rate. And so no provider wants to do it. And so what we would like to ask is that the supported living rate be adjusted to the 4-person group home rate so that more people will want to be able to do this service, because this is where the Commonwealth wants and needs to go for residential services. And lastly, we are so thankful that you and the governor have all been committed to trying to end priority 1 waitlist. And anything that we can do to help support you and make certain that these families that we see week after week come to our agency and say they're on the wait list and now they're in crisis, getting services would certainly help. But we also need the providers to provide the excellent service that they require and they need. The folks that are coming to us now are much more complex, either medically or behaviorally. And we ask a lot of our workforce. Please help support us. But again, thank you very, very much for what you've done in the last 16 months, because the 12.5% first time go around when we were in crisis, and now the rate increase of this past year that you voted on at the last session has been a tremendous impact to our agency. And I thank you on behalf of all providers.
The next speaker is Grace Reef.
Good morning. My name is Grace Reef, and I'm speaking on behalf of Child Care Aware of Virginia, a statewide nonprofit that works to help families find childcare and with childcare providers to offer high quality care. Virginia's economy is better now than it was a year ago, and much better than it was 2 years ago. But it's not better for everyone. Here in Virginia, unemployment is nearly down to the same level it was in January 2020, but many mothers have dropped out of the workforce. The Census Bureau says nearly 100,000 parents in Virginia are not working because they're home caring for children, not in school or childcare. For household economic stability, For economic recovery and growth throughout our state, parents need access to childcare. Without childcare, it's really hard to work. Parents can work it out for a short time, but it's just not sustainable. Statewide, there's a staffing shortage in childcare. What that means is that some programs have a waiting list because they just don't have the staff to operate at full capacity. Other programs are choosing not to offer infant and toddler care because you need more staff to operate those rooms. Ask any parent. Infant and toddler care is the hardest care to find, and that's if you can afford it. Child Care Aware Virginia wants to operate a substitute pool in each of our 5 regions. This would help childcare programs fill short-term vacancies when staff are sick or call out, and also help temporarily bridge the gap in staff vacancies. This is the way the substitute system works in K-12 public schools. But because of the way the background check process works in childcare, a substitute pool is hard to operate because the sub literally needs a background check for each program they work in, a separate check for each facility. What that currently involves is anyone who wants to be a sub needs to stand at the live scan machine for 20 minutes to take 10 separate sets of prints, 10 prints of the same person. That enables the state to share a clearance letter with each of 10 programs that might want to participate in a substitute pool at about $60 a pop. That's $600. We would like to work with communities to have a pool of individuals who are background check cleared and trained so that they can fill in as substitutes as needed. This would help keep programs open. It would help reduce waiting lists, and more parents would have childcare choices in their community. We can do this, but to do so, we need to restore common sense to the background check process. Because the process is set in statute, we need your help. A little flexibility would enable us to operate substitute pools, which is good business, enables parents to work and access childcare. Thank you for listening today. I also ask that Child Care Aware of Virginia's policy agenda be inserted for the record. Thanks.
The next speaker is number 22, Karen Smith, but she does not appear to be present yet, so we'll check at the end if she does join us. So the next speaker will be, yes.
Karen Smith spoke earlier, taking the place of someone else who is not going to speak.
Okay, well, that's, you can check her off. And
you're taken care of, so.
Very good.
Just a couple of speakers before.
Okay, great, thank you. So number 23 is Donna Shipman.
Hello, everyone. My name is Donna Shipman, and I live in Knoxville, Virginia, but I also work in Woodbridge and Manassas. And I am here today to talk to you about 2 Daves. Dave number 1 is a success story, and it's all due to the services that you guys have allowed us to provide and the support and the funding that you gave so that we could care for Dave number 1. Dave number 1 had been in our program for almost 30 years. And he became extremely ill, and he was in and out of the hospital quite a bit. And at some points, he was on 10 liters of oxygen. His situation was dire. He came to the end of his life, and we knew, he wasn't going to live, and he was put on hospice. But due to his having a waiver, we having nursing, and we having really good, dedicated, direct support professionals in his group home, we were able to bring David back to his home so that he could be with people that he knew and who loved and cared about him. He was able to live his last days in his home, comfortable. He was able to say goodbye to his friends and his housemates. His housemates was able to give him that love and that closure. And that was due to his having a waiver and the services that he needed to have a good life and a life like ours. And again, I want to thank you guys for that. David number 2 is a different story. And I was on the phone with him last night at 9:00, and I asked him if I could share his story, to his journey and what's happening with him. And he did give me permission to do that. David number 2 is in our supported living program. He's always been a very hardworking young man, and he, works in Fort Belvoir, and he takes pride in his job, and he has a life partner that also has a disability as well and needs quite a bit of support. But they live a good life, and we've always been able to support them in their home. But due to a major medical issue that David number 2 had, we thought first that he had cancer, but it ended up being a large tumor. And then, he had to have a catheter that was very difficult for him, as a man, but he was unable to safely take care of that need. So all in one fell swoop, David was stuck. He couldn't go to his job that he loved. He'd get up every morning at 5:00 to get there. He could no longer do that with the catheter. He could no longer live in his apartment with his partner because we did not have the staffing to care for him, because he had to have that bag changed every 2 hours and it had to be measured. And with supported living, you don't have that type of manpower. So Dave had to move into another program. And because he did not have a waiver, there was, nowhere else to go. But we as an agency, we're committed to all the individuals that we serve. And so we were able to get together as a team and with Dave and his life partner, and we were able to move them into a group home in the basement so that he could get the medical care that he required. Because again, he doesn't have the funding. There's no waiver. He's on the priority 1 waiting list, and he's probably going to be on there for a while. So now he's going through this major health scare. He can't be in his home. He can't have his job. And his life is just stopped and is stuck. And now we don't know if he's going to ever have the funding for us to give him the care that he needs in his home. So I'm asking you, because last night I was hoping, that I would be able to tell Dave and his partner, hey, we found, staff to look out for you guys who can take care of your medical leave needs, and you can go back to your apartment, your home, where you're comfortable and where you want to be, and not in someone else's home that's not used to you being there. And I had to apologize to them both so many times because I felt like I let them down. You can't go home. We don't have the staffing to take care of you. We don't have the waiver and the funding to pay for staff for you. So we are still trying to work on this situation. He was understanding, but he was very disappointed. I am hoping that by telling David number 2's story, that we can decrease that priority 1 waiting list, and that we can also, for our supported living program, have competitive rates so that those individuals that have some independence can get the supports that they need as well. And then also, I would love for you guys to, continue to increase funding so that we could hire qualified staff, because right now it is so difficult because what we're able to pay is not what people are willing to work for. So it leaves people like David number 2 out there without the services that they need to live a good and safe life. I'm hoping that with your support, I can have a success story to testify to you guys next year that we've given David number 2 a great life like you guys helped David number 1 have. Thank you. I'm not going to take any more of you guys' time.
Next speaker is Mary Braxton.
Hi, good morning, everyone, and thank you for the opportunity to speak today. My name is Mary Braxton, and I am a child care specialist at the Child Care Network in Fredericksburg, Virginia. I work with child care providers and programs daily to promote high quality and best practices of child care. For more than 25 years, however, I was a family child care provider myself and an essential worker, working on the ground with those children and families every day. I cared for infants and toddlers, and as well as school-age children who needed the before and after school care. Now my job is to help child care providers to become licensed, to offer technical assistance to child care providers and programs to strengthen their quality of care, and also educating parents on what to look for in selecting safe, quality child care across our areas. It's unbelievable that we're entering the 3rd year of the COVID pandemic, and this definitely has been a very trying time for so many. And that includes for families who have children and the child care providers themselves and programs themselves. Many people have been fortunate to be able to work remotely, but like other essential workers, childcare is an on-site job. There is no remote childcare that's possible. The past few years have been definitely trying for so many, and for families with children and also childcare providers. Unemployment is much lower now than it was a year ago or even 6 months ago, and it's back to nearly the same rate as it was in January of 2020. But that's only part of the story. Nearly 135,000 adults in Virginia have dropped out of the child care workforce. And many of them that have dropped out of the workforce are mothers. And the main reason they're dropping out of the workforce is the pay. I have a few recommendations for consideration as the General Assembly gets underway for the new session. First, child care workers are the workforce that supports all other workforces. Child care supports the economy. While child care work is a support, it's also the job of the child care workers to promote the healthy development of children, those children that then later enter our school system. Yet for this important work, child care workers earn about $11 per hour last year, $11.74 last year. On January 1st, the minimum wage increased to $12, so they likely will make a little more now. Child care is one of the lowest paid occupations. And yet the earliest years are when a child's brain is developing the fastest, and that takes place in childcare. In fact, it builds the foundation for all future learning and school readiness that takes place. That's what makes the work of the childcare provider so critically essential and important. What's needed is a wage supplement strategy to increase the pay for those working in childcare. But let's be honest, parents can't afford to pay more. What I see on the ground is a tight labor market where childcare programs cannot compete against other local businesses to recruit and retain workers. We urge that the General Assembly use some of the additional federal childcare dollars that Virginia has received to develop a wage supplement strategy with the Department of Education to help boost childcare pay. Keep in mind that a family childcare provider or small childcare center will need a way of paying that minimum wage increase while keeping childcare costs affordable for families, because working families already struggle to keep up with the cost of childcare. Second, there is a childcare staffing shortage. When workers call out, either sick or to attend a training or take personal time off, unlike the public school system, where K through 12 teachers are temporarily replaced with substitutes that have already been cleared, There's no substitute pool for the childcare field. We need to fix the background check system so that there is much more flexibility within the communities to have a background check screened and trained substitute pool to fill in when needed at childcare programs. Currently, there are programs that have waiting lists for children due to staff shortages and programs that have 1 or 2 rooms still closed due to those staff shortages. Therefore, there's a waiting list of parents who need childcare. Those people cannot get back into the workforce themselves, which impacts the entire economy. A substitute pool could help bridge this gap. Please support legislation to provide flexibility related to the background check process. Thank you for listening today, and I will also be submitting written comments, which include the Child Care Aware full set of recommendations for the General Assembly this upcoming session. Thank you so much for your time and your services.
The next speaker is Rose Daniele, but she does not appear to be here, so we'll check back at the end. So then we'll move on to number 26, Shamitra Jackson. Shamitra, if you could unmute yourself. There you go.
Having a little bit of trouble. Thank you, guys. Good morning. My name is Shamitra Jackson, and I represent the ARC of Greater Prince William. I live in Manassas, but I do work in Woodbridge as well as Manassas. I appreciate your time, and I really wanted to speak on the staffing crisis that most organizations are facing here. Most of the employees who work have to work multiple jobs to really survive in this Northern Virginia area. What most providers are able to pay is not sufficient, and therefore the workforce that is working is overworked, underpaid, and usually burnt out. And so, I apologize for the light. So often, most of our staff are not giving their best when they're at work because they are stressed. Most of our employees also have English as a second language. And with all of the regulation requirements that keep changing as far as trainings, it is a struggle for providers financially to keep up with those demands. So we ask of you for you to support the ARC in the workplace development campaign, support paid leave, and really help us create a career path for the DSPs moving forward. Thank you for your time.
Just one announcement for everyone in the hearing is that we're halfway through the speakers list. If for any reason we bypass you because you weren't present, we'll double check and see if you're present at the end and let you speak. So the next speaker would be number 27, Leslie Houston.
Good morning, senators and delegates. I am Leslie Houston, the president of Fairfax Education Association. I am here today on behalf of the Fairfax County public employees I represent, the students we care for, and the community we all serve. First and foremost, thank you for taking the essential steps towards making Virginia a better place for working families by allowing public sector collective bargaining, a practice employed by more than 2/3 of the nation. We also support repealing right-to-work legislation, which would set us on a path toward fair labor practices, effective contract enforcement, and ensuring that employees' voices matter. We are excited for the hard work ahead. However, we are faced with the worst teacher shortage in the history of education, and not providing competitive wages will continue to push them out of the door. Incentives such as bonuses no longer suffice. They are no longer enticing. Meaningful investments that will improve retention and recruitment is needed to help reduce the increasing workload of educators and staff. Virginia is a state that is consistently producing top 5 results. It defies logic by showing support through decreased funding, And even worse, by not rewarding educators and support staff with a living wage. I am a special education teacher with 3 degrees and working on my 4th, but I could not live here if I were not married. Educators and staff should be able to live where they work. In August 2021, Virginia was said to be the worst state to teach in. And when comparing teacher wages to other occupations, the Commonwealth ranks 50th in the country. An anecdotal report of young, single, or married educators having to leave Virginia due to cost of living has been occurring since the early 2000s. Educators and school staff do not want to keep losing the gains we have accomplished. We need to turn this around for our children, for future generations. We must fully fund public schools and we must fund salaries. It is a necessary investment. I continue to say, if you take care of the people taking care of the kids will be taken care of. Finally, FEA and VEA members are experts in the field of education. We are here to help and support your efforts, and we are willing to provide guidance to you. I implore you to utilize our expertise. Thank you and good luck to each of you in the general session ahead.
The next speaker is Janelle Gilmer.
Hello and good morning, everybody. My name is Janelle Gimmer, and I am someone who strongly believes in promoting equal rights and those getting the supports they need in any way possible, whether that's the Medicaid waiver, the CCC plus waiver, just anything, as far as their, supports they need and everything. I believe that we should be promoting dignity and respect for people with disabilities that have a hard time speaking for themselves. I need people to work with them. The reason why I'm coming to you today is because I like to discuss a couple of things that mean a lot to me, that I believe that probably mean a lot to you. The first thing I want to speak on is the provider rates. I believe that for provider rates, for those in our agency at the ARC, that those who are fighting for those, putting their life on the line for those who just individuals or clients with either developmental disability or intellectual disability. I feel that's very important to everybody in our community in everyday life, speaking with families of children and adults with those disabilities, because our providers or DSPs put their lives to the forefront of the core of their everyday needs, 24 hours or less, every day, even on weekends, to fight and work with them. They care about what they do, and they mean a lot to all of us, including myself, because I know how much they're making a difference and how much they truly care and respect the people they work with. They've grown a bond in relationship with them, and they really know who they are and what they're getting themselves into when they place their life every day to take time and work with them. I feel it's a challenge it's kind of hard for people in direct care when they're trying to get to, access what their job means and why it's important to do the work they do. And that makes a lot of difference, and means a lot to the families they're supporting, because in direct care and support, they do it because they honestly know it's worth doing. It means the world to everybody, and it's something they should do from their heart, not just to do it for other reasons or gain. The reason I think we must not forget this is because people with disability, they deserve people to work with them. It doesn't matter what your disability are. And I just feel, in my opinion, that people who are working in with the rates for the providers, for group homes or even support living, as Donna and Karen Smith I mentioned earlier, that they're not being heard either. And I just feel we need to work together in the issue. The second thing I want to speak on is waiver slots. As I said, someone with IDD or autism, most of the cases you hear of people have autism, epilepsy, cerebral palsy, that's today. Well, as someone who fits into that triangle, triangle and I'm an adult, I feel that doors should be open for those who are trying to seek priority folks, just like the lady earlier, I believe it was Elizabeth that spoke on saying that she had been on the DD waiver and she was just getting off. So I just would like to see us better support that, a better plan the system over the years to break this challenge and work together in that, matter. Also, I want to speak on DD outreach days. For the DD outreach days that we are, getting ourselves ready for during the year for the legislators, I feel like, we should invest more time and growth in knowing how we can advocate and what we're doing and why it's very important. I feel it's a great benefit for us to have a role in that, speaking to legislators, meet with them every year in Richmond when we can due to COVID, and just getting to know more who our legislators are and what they can do for us and for those in our life, our families or siblings, just so we can better speak up and use our voice to tell legislators that we serve and have a life like yours, that our biggest goal and dream is that we can do this and to try to get rid of those objectives are our barrier and the reason why maybe we are having a challenge in promoting the sacrifice and support that we need. Lastly, is housing. I've always wondered, since I am on autism spectrum, I have Asperger's high functioning. I just really would like to know what it's like living on your own, having disability, to adapt to change in society, to know what my option is when I'm aging out of this, the adult, as an adult, and aging out of other options, as someone who now works, and it's took me a long time to work. Now I finally work, and I'm grateful to have a job. And yes, I work at the art of people that are people who have disability. As myself, I just want to know what role can I play in helping others to learn more about their need to want to live in housing and what I can do as far as me and my guide and support plan in living in my own home one day. What's the advantage that I have and do my own decisions, how I can, get the supports that I need to one day be independent and live my life. I mean, I am fairly independent. I'm fairly cognitive. I can take care of myself. I do things for myself daily at home. I help out with family. I just want to know what can I do to show that I am also too fair, equal of me learning to do things and be in the community more often and adapt more to change, as I said earlier, in society, where I can one day, as well as those that I am know and personally have spoken with even as friends, to just one day meet my goal. And the last thing I want to say is that we should all get the rates off for Group Homes SLP and just, try to work on knowing that we can make any advancement, and just knowing that we do have the option of one day being where we need to be in life and that we will make this happen. Thank you again for having me speak today. It was a true pleasure and honor. Thank you for letting me speak, delegates, and I would definitely look forward to seeing you on the 19th in Richmond. Thank you.
The next speaker is Karen Tefelsky.
Good morning and Happy New Year. I'm Karen Tefelsky, and I proudly serve as the Executive Director of the Virginia Association of Community Rehab Programs, better known as Virginia Access. First and foremost, I want to thank all of you for your leadership in funding the DD waiver rate rebase increase provided during last session. We are so very grateful, as this has kept many providers from going completely out of business. This was a substantial first step in increasing provider capacity, which was devastated during the COVID pandemic. But please note, those rates were based on a 50 percentile of the Bureau of Labor Statistics as of March 2019. The workforce crisis continues to plague the provider community and its sustainability. Our providers are still experiencing vacancy rates in the mid 30 percentile, and some have had an 80 to 100% turnover rate during the last 2 years. Providers continue to close residential homes, and many day and community engagement providers are only providing 50 to 60% of their pre-pandemic clientele. All of these due to workforce issues and patient to staff ratios. Many of the waiver slots provided during the last 2 years are going unused because of this workforce shortage. And this is exacerbated in Northern Virginia as we compete with the minimum wage rates of $16.50 effective January 1 in DC, which will go up to $17 an hour effective July 1st, and $14.50 and $15 minimum wages in Maryland. It is important to note that DD providers rely solely on the DD waiver rates that are provided by you. We don't have patient pay. We don't have private insurance. We don't have any of those other funding alternatives. So provider capacity and the sustainability of that capacity is critical. This session, we are asking you to once again make DD rates a priority. We need you to refresh the current DD waiver rates this year based on relevant inflationary data, minimum wage increases, increased administrative burden, and regional market-based costs to ensure recruitment and retention of qualified staff. We ask that you support language to require a DD waiver provider rate rebase on a 4-year cycle beginning in 2024 based on the 75th percentile of Bureau of Labor Statistics to ensure competitive market-based rates. We ask this for 2024 because the last rate rebase was based on 2019. We ask you to fix and fully fund the CD services by service facilitators included in the DD waiver rate rebase. CD services were not included or fully funded by the state rebase provided by you during the last session. So this needs to be fixed, as does peer mentoring services. We ask that you support an inflationary cost of living increase for employment services organizations linked to the 8.7 total increase provided by the Social Security Administration, which is based on the 2021 CPI. And we ask that you support policy that eliminates disincentives to employment for Virginians with disabilities. You heard from parents and other panelists this morning regarding some of these issues, but we want to make sure that it includes expanding the Medicaid Works Program eligibility to individuals receiving the DD waiver, as will be proposed by the ARC and the DD Coalition, of which we are a member. And last but not least, we ask that you support the DD waiver system transformation proposals by the ARC of Virginia. We proposed these last year in the rescue plan, all of which are one-time funding requests to help promote the workforce and retention of qualified staff in the DD system. Thank you, and we look forward to working with you this session.
The next speaker is Alan Rossum.
Thank you, Mike. My name is Alan Rousum. I'm Executive Director of the Northern Virginia Conservation Trust. We are based in Annandale, and we are the regional land trust for all of Northern Virginia. I appreciate so many of the senators and delegates being with us today. You are all really important conservation champions, and we've worked with many of you before to make Northern Virginia greener and protect parks and open space there, and appreciate you and your continued support. We also appreciate that you hold these hearings and that you're willing to listen to us and many of the priorities that we see throughout the Commonwealth. The biennial budget allocates a historic $1 billion in funding to restore the Chesapeake Bay, helping Virginia meet the 2025 deadline to reduce pollution entering our creeks, streams, and ultimately the Bay. Governor Youngkin added additional funding to protect our waters, and those amendments included an additional $237 million to Virginia's wastewater treatment plants and $137 million for Virginia's agricultural cost share and related programs. He also maintained the land conservation funding, including Virginia's historic investment in outdoor recreation and trails, but much more is needed as climate change and overdevelopment, especially in our region, are adversely affecting our parks, our natural areas, and our waterways. While maintaining funding levels is important, the governor missed opportunities to fully fund Virginia's key land conservation programs, including the Virginia Land Conservation Foundation grant program, a program that we've used very, very significantly in Northern Virginia to protect many places in your districts, the Farmland Preservation Program and the Office of Farmland Preservation, the Virginia Outdoor Foundation's Get Outdoors program, mussel population restoration projects, the state's Wildlife Corridor Action Plan, and the Department of Forestry's Trees for Clean Water program, all funded at flat levels, but need significant more investment, and we hope to work with many of you on budget amendments to increase those programs. We do appreciate the governor increasing investments for the Virginia Black, Indigenous, and People of Color Historic Preservation Fund, bumping that new program funding from $5 to $10 million. Finally, we appreciate that the governor recognizes the need for statewide flood resiliency investments by allocating $200 million for the Resilient Virginia Revolving Loan Fund, though those dollars are contingent on surplus revenues. And he also allocated $1 million over the biennium to coordinate and strategize flood resiliency policy in the state government and to identify federal funding opportunities. Though this additional funding from the governor for the loan fund is important, it cannot be a replacement for long-term funding for the Community Flood Preparedness Fund. This fund provides communities with flood resiliency infrastructure and has already invested over $235 million in flood resiliency across the Commonwealth, thanks to Virginia's participation in RGGI, the Regional Greenhouse Gas Initiative. This critical funding source is only the beginning of our flood resiliency efforts, with many millions of dollars more needed. The loan fund that the governor prioritizes does not focus on nature-based approaches, nor the requirement to dedicate 25% of funding to limited resource communities. The continued prioritization and involvement of low-income rural and tribal communities in flood resilience, planning, and adaptation, as outlined in the Community Flood Preparedness Fund, is essential. Ultimately, the governor and the General Assembly must maintain our participation in RGGI and guarantee 45% of revenues generated from RGGI continue to be allocated to the Community Flood Preparedness Fund, which is the best tool the Commonwealth has to protect communities from recurrent flooding. Thank you for your time today. We appreciate working with many of you throughout this session, and looking forward to increasing investments in Virginia's outdoors.
The next speaker is number 31, Anthony Nunez.
Good morning, everyone. Thank you. My name is Anthony Nunez. I'm the CEO of INF Care and Commissioner on Aging for Arlington County. And I am also a member of NVAN, which I am representing today here. The two topics I'll be talking about are expanding the livable home tax credit from $1 million a year to $1.5 million per year, and creating a livable home grant program of $1 million per year for lower income homeowners. An estimated 1 in 10 Virginians has a disability. Additionally, about a quarter of Virginians will be over the age of 60 by the year 2025. For these individuals, accessible housing is a high priority. The Commonwealth's Livable Home Tax Credit Program is designed to improve accessibility and universal visitability in Virginia homes. It provides state tax credits for the purchase of new units or the modification of existing units. Tax credits are available for up to $5,000 for purchase of a new accessible unit, and up to 50% off modification cost of existing units, up to $5,000. The program was open to building contractors in 2011. The tax credit is a significant incentive for accessible home modifications. They keep older adults and people with disabilities in their home. This is absolutely very important for us in Virginia. This program has met or exceeded the allocated $1 million for the last 9 tax years, demonstrating there is a high demand for increased funding. Raising the level above $5,000 would provide a more effective incentive, as well as would developing a grant program, especially for homeowners whose income is too low to qualify for a tax credit. Thank you.
The next speaker is Judith Ursitti. Judith, if you can hear me, go ahead and.
Can hear you.
Yes, we just don't have your video, but we can hear you. So go ahead.
Okay. Good morning, everyone. It's an honor to be here today. Many of you have served as champions for the autism community in Virginia over the years, and it's been my honor to work with you. I am Vice President of Government Affairs for the Council of Autism Service Providers. We're a nonprofit trade association nationwide, and we have many member organizations in Virginia that advocate and live in your districts. I'm here today with a simple request, and that is to ask you to please consider removing budget item 285B. It's the implementation of rate setting for private day schools in Virginia. Private day schools serve very severely affected students between the ages of 3 and 22 who are on IEPs, individual education plans. And these students access services that many of you likely cannot imagine. Some of you have visited these programs, and we're so grateful for that. But these students fall into the range of the autism spectrum that is considered profound. They have severe challenging behaviors and need very individualized ratios and supports. These supports are mandated under the Individuals with Disabilities Education Act, and Virginia has served these students well historically, finding the least restrictive environment for them so that they can access the curriculum as they should. So, as I said, the request is simple. We ask that this rate setting language be removed. It's problematic because it does not contemplate the individualized ratios of support that are needed for this population. We'll be visiting many of your offices in the coming days to answer questions, but I am so grateful for your time and attention today.
The next speaker is Terry Lynch, but she does not appear to be present. So the next speaker is number 34, Robert Efert.
Good morning. My name is Bob Eifert, and Senator Barker, members of the General Assembly, thank you for this opportunity to be here. I'm here today representing the Northern Virginia Aging Network, or NVAN, and want to say that Terry Lynch, who was supposed to precede me, was not able suddenly at the last minute to testify today, so she has submitted her testimony in writing, so it will be a part of the record. Thank you. And I want to thank you for your good stewardship and of state resources by having this virtual public hearing today. By so doing, you have allowed people to participate and express their views without having to travel to a single location. We at NVAN, along with the City of Alexandria and the counties of Arlington and Fairfax, are all advocating for the right to have advisory board and commission meetings, such as Commissions on Aging or Disability Services Board, that are all virtual rather than in person. The requirement that meetings be in person or a hybrid model that requires an in-person quorum discourages participation, especially among those who have transportation issues, such as older adults and individuals with disabilities. The greater the distance to the meeting, the greater the hardship imposed by the in-person requirements. Conversely, allowing virtual meetings that are accessible to everyone will increase participation and transparency, both goals of good government. Dropping the in-person requirements for local government advisory boards and commissions will cost the state nothing, but will have a positive personal budget impact on the individuals who do not have to travel to in-person meetings. We urge you as delegates and senators to change these requirements to allow local jurisdictions to decide for themselves what meetings need to be in person. Thank you for your consideration.
The next speaker is Jen Riley.
Hello, Dr. Jen Riley couldn't make this time frame, so I will be speaking for her instead. My name is Jessica Anderson. I am the Rehabilitation Program Manager at the Blue Ridge Wildlife Center. We're the only full-service wildlife hospital in Northern Virginia, located here in Clark County. I hope you will support funding for wildlife corridors across the Commonwealth and leverage federal funds via the Infrastructure and Investment Act, where over $350 million have been made available for wildlife corridor funding. This is both a wildlife and public health issue, and as a VDOT site study demonstrated, such corridors can decrease deer vehicle collisions by 92% and can pay for themselves in less than 2 years. At our hospital, 15% of our over 3,000 patients per year come in due to vehicle collisions, making it our single greatest cause of injury. And this includes 545 animals in 2022 alone. Though it's not legal to rehab adult deer or bear in Virginia, we do receive dozens of phone calls about hit by car deer and bear every year, and it takes incredible resources on our end, as well as local police, VDOT, car owners, car insurance companies, etc., to mitigate these issues, a percentage of which corridors could prevent. When local police are called to dispatch injured wildlife, they do so with government-issued bullets, which are almost exclusively lead, which additionally pollutes our environment and poisons the scavengers that come to feed on those carcasses. Those corridors may not directly help birds. Most hit by vehicle birds are raptors, who are scavenging dead mammals off roadways. And if we decrease the number of dead small mammals in roads, we decrease the number of scavengers hunting, feeding along the roadside, and the risk of associated lead poisoning. We do have 3 large wildlife hospitals here in Virginia with excellent found location information, and we hope that we can use this information to pinpoint the areas at which corridors would have the most impact. We know in our area that certain stretches on specific highways have more incidents than others. And otherwise, thank you for your guys' consideration of funding such corridors and hopefully saving taxpayer money while helping wildlife and public safety.
Next speaker is number 36, James Wilson.
Hi, I'm Jim Wilson. I live in Burke, Virginia, and I also want to talk about wildlife corridors. And thanks to Senator Marsden for sponsoring that legislation. I'll try not to repeat what the person in front of me just said, but we're looking for, now that we have a wildlife corridor action plan, to have money put into the budget somewhere in the order of $5 million initial funding. We think there's going to be payoff in getting federal funding for some of these projects moving forward. I'm the chair of the State Council of Trout Unlimited. So our angle on this is there's aquatic corridors as part of this, and there's 3 species, including eastern brook trout, which we're primarily interested in. So we've been involved in the state, working in partnership with groups like the Piedmont Environmental Council and identifying problem culverts and other places that keep us from having connectivity in our streams and rivers, and trying to attract funding to solve some of those problems. So we just think that having the state put together a database with a central focus, and then having an organized effort in order to prioritize actions within the Commonwealth will be very helpful and very efficient. We look forward to working with the appropriate state agencies. We're a grassroots organization. We've got a lot of people on the ground who are getting training and trying to identify some of the problem areas. And we look forward to, if we get some funding on this, to work with the state to try to make these improvements. So thank you for your time.
The next speaker is Christopher Miller, but he does not appear to be here. So we'll move on to number 30.
I'm right here. I'm on.
Oh, I'm sorry. My bad. I didn't see you there. Go ahead.
Right next to you on my screen. Hi, I'm Chris Miller. I'm president of the Piedmont Environmental Council. I want to start by reminding you that we provide direct services in conservation, water quality, historic preservation, community planning in 9 counties, and ranging from Loudoun and Fauquier in the northern part of the state and down to Albemarle County. We also support work all across Northern Virginia, Central Virginia, and the Northern Shenandoah Valley. So thank you very much for what you have supported for years. Virginia is a national leader in land conservation and water quality improvement. And some of the things that you've heard already today about wildlife crossings and the expanded access to land conservation for African American community, descendants communities, the fund for tribal land conservation. These are huge innovations, and you are national leaders because of your support. So thank you for that. I want to highlight 2 areas where we need more effort. One is farmland preservation. We've routinely asked for a larger funding of the Office of Farmland Preservation and the support of county purchase of development right programs that are targeted at agricultural land conservation. But I want to highlight the need for matching funds, hopefully just through an addition to the Virginia Land Conservation Foundation, so that we can leverage the full amount of Farm Bill money that's in the agricultural land easement program in Virginia. We get a disproportionately low share of that nationally, and given the strength of our farmland in producing in productive agriculture and in forestry, we should be using those funds more aggressively to advance our statewide conservation goals. The amount is obviously something to discuss, but I think $10 to $15 million of federal funding is available. It requires a 50% match, and it would be great to have the state funds available to take advantage of those federal funds. Happy to work with the committees on how to structure that, but something that I think we can be targeted on. We support more funding for wildlife corridors, both terrestrial and aquatic. We've been working with VDOT to try to deal with the engineering standards so that we get stream and river crossings that allow for passage of brook trout, allow for passage of the American eel and shad up to higher reaches of the streams, which are better reproductive habitat. So these are things that are really advancing Chesapeake Bay wide goals and Virginia specific goals. And I hope that you will give them consideration as they move forward. And that I'll close just by saying thank you again for everything you've done to support land conservation, water quality. We look forward to working for even more support in the years to come. Thanks.
Next speaker is Joanne Aceto.
Good afternoon. I'm Joanne Orchantacita with MVLE, which is a nonprofit provider of day and employment services to persons with disabilities in Northern Virginia. I'm also speaking on behalf of Virginia Access and our legislative platform. The private sector is the roots to the IDDD services in Virginia. You all know that. If we don't support private providers, the tree is not going to grow. And we're at that point. Many of you on this committee know of MVLE's support and the work we've done in Northern Virginia. We've been doing this for over 50 years. Post-pandemic, we are supporting about 60% of the people we used to support. Post-pandemic, the provider community has more significant issues with hiring and retaining staff as we see minimum wages increasing to almost $17 an hour in nearby areas. We cannot address the governor's goal of reducing the waiting list without significant financial supports and reductions in the unfunded administrative burdens placed on providers. I mean, the inflation rate alone, you all know this, what is going on with inflation currently post-pandemic. We implore the legislators this session to continue bold, significant prioritization and investment to stabilize Virginia's waiver program and the workforce crisis. To build provider capacity and sustainability, we have to continue with refreshing the DD waiver provider rates annually based on relevant inflationary data, the minimum wage increases, and the increased administrative burden that the providers are incurring. And this will ensure retention and recruitment of qualified staff. We also need to rebase the DD waiver provider rates on a 4-year cycle to ensure competitive market-based rates. We do appreciate the rate increases that happened last year, but it's just not enough as the inflation rates just continue to grow and grow. We also need to fix and fully fund consumer-directed services provided by service facilitators. We also want to work with you to reduce administrative burden and transform our regulatory processes. We've done this in the past, and we need to continue to do so. We also want to work with you on reforming licensing system review and the DD waiver regulatory staff competency language, and to be able to use an accreditation by a national body such as CARF. And we've done that for some things in the past. We need to expand on that. We also want to expand access to modernized technology and supports to include options for virtual programming. We have done those in the past. We need to get that back on track. We also want to work for promoting jobs and employment supports for all Virginians and to support annual cost of living increases based on inflation and to have any COLA increases provided by the Social Security Administration to provide quality employment supports. Again, the private sector is the roots of the IDDD provider community. We need legislative bold support to keep the trees growing as we support persons with disabilities. We look forward to working with you all this session. I will give a shout out to Delegate Reed since I do live in his district, and we all will continue to work with many of you during the session. Thank you.
The next speaker is Jill Barker.
Thank you very much. Good morning. My name is Jill Barker. I'm a longtime resident of Arlington County, a supporter of the Chesapeake Bay Foundation, and a volunteer park steward at Upton Hill Regional Park, owned by the Northern Virginia Regional Park Authority. As volunteers and I work diligently each Thursday afternoon, which is where I'm going next, we work at this site to remove invasive plants among the seeps and springs. I have come to realize that we are essentially working on the headwaters of the Potomac River and the Chesapeake Bay. Even though the waters collected at Upton Hill that run into Reeves Creek and then into 4 Mile Run do not have a name, these waters have downstream effects. The same is true for the Potomac Overlook Regional Park that drains Donaldson Run directly into the Potomac River. Erosion on these and other properties in Arlington and throughout our region combine to create a collective impact on the water quality in the river and the bay. Virginia waterways, including the bay, are among the state's most precious resources, providing recreation, drinking water, and many jobs. The 2025 deadline for Virginia and the other bay states to meet their bay cleanup commitments is fast approaching and will occur during this gubernatorial administration. I urge the General Assembly to continue its investments in clean water practices that meet pollution reduction goals identified in Virginia's Water Implementation Plan. I thank the governor for including $237 million to continue the process of upgrading wastewater facilities across the Commonwealth. This ongoing work has made a huge difference in the quality of Virginia's waterways, including the Potomac River. I ask that you support the Commonwealth's fisheries by providing $2 million for the Virginia Fisheries and Aquatic Wildlife Center's mussel restoration efforts, and $225,000 for the Virginia portion of the blue crab stock assessment. Finally, please support our government's efforts to achieve nutrient reductions from stormwater projects by appropriating at least $50 million for the Stormwater Local Assistance Fund. Arlington County received a $500,000 grant from this fund to retrofit the Ballston Pond project, which drains approximately 300 acres of urban and suburban land. This restoration will provide increased water quality treatment and is expected to reduce pollution considerably. Consistent and adequate year-to-year funding for SLAF will help communities plan and budget for large-scale projects that are necessary to improve the health of the Bay. Thank you all for your wonderful leadership and protection of our environment. Thank you.
The next speaker is number 40, George Rogers, but he does not appear to be here at the moment. So we'll move on to number 41, Jane King.
Thank you so much for enabling me to speak on behalf of the Northern Virginia Aging Network today. I am a resident of Alexandria, Virginia, and I will be speaking to the Northern Virginia Aging Network priority, which is require employers to provide at least 10 days of sick leave for all workers, including direct care workers at nursing homes, assisted living, and home care. First, providing 10 paid days sick leave for all workers, and I emphasize all workers, is so important to prevent widespread contagion of disease. At this time, federal requirements for sick leave are very limited. 14 states and Washington, D.C. now do have paid sick leave. Paying paid sick leave is cost effective for business. The economic costs, for example, of a serious flu outbreak are enormous, according to the Center for Economic and Policy Research. And according to the National Partnership for Women and Children, paid sick days reduce turnover. This is particularly important in lower wage industries where turnover is highest. And I think you all understand that getting people to do this work right now is being resisted. So this is as important as ever. And providing 10 paid sick days to direct care workers in nursing homes, assisted living, and home care is a major public health issue and an NVAN priority because it is the heartbreaking truth that direct care workers can spread disease. According to a nursing professor, these are the folks who can least afford not to go to work when they're not feeling well. And they may be, unfortunately, the ones who spread such viruses as COVID. The alarming outcome of failure to pay paid sick leave for direct care workers is that they must frequently work while sick to support themselves. Why is this so alarming? Because these workers clean and bathe residents, trim their nails, shave, brush teeth, toilet, and dress them. In other words, they're in very close proximity to those that they support. But the wages of direct care workers in facilities are so low that many feel compelled to work when they are sick. And their families obviously may depend on their meager incomes. As of August 2022, the average direct care worker salary was $27,333. They expose those in their care, as well as family members, colleagues, and the public to grave illness during the current pandemic or whenever they are sick. We do, however, want to thank you, members of the General Assembly, for taking a good step in passing legislation that requires up to 40 hours paid sick leave for direct care workers who average 20 hours per week for Medicare consumer-directed home care services. The General Assembly should expand the coverage to 10 days, should cover workers in Medicaid agency-directed care in addition to consumer-directed care, and should cover workers in nursing homes and assisted living as well. Thank you so much for giving us your time and your consideration. We truly appreciate it very much.
The next speaker is number 42, Sandra Sullivan.
Hello, General Assembly members. My name is Sandy Sullivan, an elementary teacher. I currently represent educators in the Loudoun County Public Schools as the president of the Loudoun Education Association. Staffing quality educators in our schools is a challenge. As challenging as it is, we must find ways to ensure our schools are fully staffed with the best educators. It is critical to provide for the wide-ranging needs of all of our students. One thing that must be done is to increase the compensation of all of our educators. In order to reach the national average for teacher pay in the 2023-2024 school year, we would have to increase teacher salaries by 10.32%. 10.32%. While it is true that pay has improved over the past couple of years, including a 5% raise last year, much more is needed. Improving salaries requires consistent and targeted salary increases for our educators. We must invest in our educators and reach the national pay average over the next few years. As we must protect public education and our public schools. Our schools and students continue to recover from the pandemic. We cannot afford to subvert funds from our public schools at any time, but especially at this critical time. Voucher and tax credit programs take needed funding from our students, and we cannot let that happen. Our students are counting on you. Our educators are counting on you. Our families are counting on you.
The next speaker is April Garland. If you can unmute and speak. April Garland?
Yes, can you hear me on the phone?
Yes, we can.
Okay, well, I'll just have to do this by phone. I'm a member of Friends of Acatine Creek, and I'm speaking in support of the wildlife animal crossings. VDOT reports some 60,000 deer crashes every year. In 2000, Virginia was number 12 in the nation for deer collisions. And the problem is wildlife habitat has become horribly fragmented due to human activity. Imagine I burst into your home and put up a wall between your fridge and your oven, and raised another wall between your TV and your sofa. And let's throw in another wall between your bed and your clothes closet. And then fill those walls with copperheads and hornets. Well, that is what our never-ending sprawl of human development is doing to our wildlife. We've chopped up their living spaces into isolated parcels. And when they try to get from one to the other, they risk becoming roadkill. How many road crossings, light switch changes, and crosswalks have we for human pedestrians? They must number in the millions. How many crossing guards are employed at $21 an hour to escort human children across roads that lack these features? Over 1,500. This is all very good, and I'm happy we have these necessary measures for public safety. But can't we spare some funding for the non-human residents of Virginia, whose habitats we have greatly diminished by pollution and development? Deers, bears, raccoons, rabbits, opossums, groundhogs, frogs, salamanders, box turtles, they need to move too. And just building wire fences by existing underpasses has been shown to be highly cost effective. For example, along Virginia's Interstate 164 near Charlottesville, VDOT put up 1 mile fences to direct wildlife to existing underpasses used by but not designed by wildlife. Well, the result was dramatic. 92% fewer deer car collisions. Money spent on enhancing animal crossings, many cost under $200,000, are offset by savings associated with less human injury, fewer deaths, less vehicle damage. Please fund the wildlife animal crossings. Thank you.
The next speaker is Rebecca Kiesling. Hopefully I got that right.
Opportunity to speak this afternoon. My name is Rebecca Kiesling, and I'm the Executive Director of NAMI Northern Virginia. NAMI, the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization. NAMI provides free advocacy, education, support, and public awareness so that all individuals and families affected by mental illness can build better lives. NAMI Northern Virginia is the largest NAMI affiliate in the Commonwealth, serving the over 2.4 million people of Arlington, Fairfax, and Loudoun counties in the cities of Alexandria and Falls Church. Our programs can help you to better understand you or a loved one's mental health condition. For over 45 years, NAMI Northern Virginia has been the leading local voice of lived experience. We understand because we've been there too. Today, we've heard from many representatives of our area's community service boards. I speak today on behalf of the lived experience, those with mental illness and their family members. I myself am both a peer and a family member and a resident of Northern Virginia for over 20 years. The work of our public behavioral health system, our Region 2 community services boards in Northern Virginia are essential to addressing the mental health needs of our neighbors. There's been a 66% decrease in the number of insured in our region. The same region where over 750,000 adults, or 39% of the population, have mental health needs, and where 200,000 adults have a serious mental illness. With so many barriers to care, without the services of our CSBs provide, our community members cannot receive the crisis services they need. The percent of people nationally and locally run jails who have been diagnosed with a mental disorder is an incredible 44%. But our local CSBs are working to change how those with a mental illness are treated during a crisis, providing treatment during stays and alternatives to minimize repeated trauma. Alexandria's Reentry Council, Fairfax County's Diversion First, Arlington County's Behavioral Health Docket. These are just some of the programs working in our community to help individuals with mental illness get the help they need and not be forgotten in our criminal justice system. Judy is a NAMI Northern Virginia member. She said to me recently, I've always lived in Fairfax County my whole life, and I didn't know anything about the CSB until my son became part of the system. The crisis response units, the people that understand that he needs help, not lockup. My son is alive. He's really thriving right now because of our CSB and the public services in our community. MCRC, MCU, the mental health docket, we know them all, and we are grateful. Just in Fairfax County CSB last year, more than 20,000 individuals received mental health, substance use disorder, or developmental disability services. 6,500 individuals received CSB emergency services, and all of this with 40% turnover in staff. Northern Virginia CSBs are more than half funded by local funds. Historical issues with inadequate state funding levels for our CSBs have hampered full implementation of vital services, like with STEP Virginia. And on behalf of those that live with mental illness, I implore you to understand how critical those with mental illness and their family members feel it is to encourage the full funding of our CSB initiatives, including Marcus Alert, mobile crisis response units, 23-hour stabilization units and crisis receiving centers, adequate inpatient hospital beds, and competitive workforce retention. With the governor's focus on mental health and the overwhelming need brought on by the pandemic, you all have the opportunity to help Judy, her son, and the 750,000 people like him that may need CSB assistance in our communities. Thank you.
The next speaker is Angela McConnell.
Hi, good afternoon. I feel like we almost need an espresso break at this point. I've been on since the beginning. I appreciate everybody's attention and staying on. And this is my first time speaking in this format, so I would say it's much different than being there in person. I much prefer talking to everyone one-on-one, but I do appreciate this platform as well. I'm Angela McConnell, President and CEO of the Northern Virginia Veterans Association. Many of you know us as Nova Vets. If you're not familiar, I'd love for you to get familiar with what we do here locally in the Northern Virginia region. I want to thank Senator Barker, Senator McPike, and other delegates such as Sewell that have been supporters of us ongoing throughout the year. And I'm glad to see some familiar faces here with us. But today I'm here to discuss the ongoing need for veterans to have equitable access to healthcare and other services. If you're not familiar with what we do, we are the foundational access bridge for underserved, marginalized, elderly, disabled veterans to be able to get the services they need. So these are veterans that cannot make a phone call easily, don't have a computer, don't have the money for internet. They just are elderly and can't get through the system, basically. And that's our specific population. So it's very niche. But what I'm finding out is the issues and the challenges and barriers they're facing are not specifically, with them. They're kind of ubiquitous for this elderly population overall. So I want to talk about how to get more equitable services for veterans, and specifically affordable, safe, and reliable transportation. This has been the #1 challenge since our inception in 2015. I've been talking with agencies, nonprofits, and other organizations over the years. And what I'm proposing to you all today is that what I want to do is provide care-coordinated transportation. We've been doing that, and access for these marginalized veterans, but also to save money across the board with many medical and healthcare institutions, government agencies. And you'll understand a little bit more of that with the remaining 2 minutes I have to speak with you guys. So marginalized veterans are those veterans who are not able to reach out and get services on their own. And because they're not able to do that successfully, we forget about them. They may try to reach out once or twice. they have a flip phone and they're making a call and they can't get through, or they leave a message, or they just end up in a dead end, and no one calls them back. And that's very typical. These are the veterans that eventually find us. And it's actually our hardest point of outreach is finding these veterans, because they're not on the internet usually. They're in their homes, they're suffering silently, and it's our job to reach out to them. And I appreciate all the delegates and senators that have helped us with outreach to this population within their districts. So that's actually key for what we do. Due to missed doctor's appointments from not having transportation, and also furthering the state of, it also furthers the state's physical and mental decline from not having these appointments, which boosts emergency room use and increased care for comorbid conditions. For example, if one of our veterans has hypertension, it goes uncontrolled. It can lead, as we know, to vision, kidney, cardiac, brain, and other end organ diseases. And you can imagine the financial cost, not alone the cost, but the burden to the veterans and the family. So what I did, because I'm very steeped in academia, in 2018, we saw a pervasive gap in need around transportation and decided to do a needs assessment with over 60 mobility programs in Virginia, Northern Virginia, to include organizations like OmniRide, Wheels to Wellness, the Veterans Hospital Rides at the DC, multiple local agencies like Area on Aging, nonprofits and churches, again, over 60 organizations. We did a needs assessment. And what we discovered as a nonprofit whose mission is to coordinate services and resources for our underserved veterans was that the current mobility programs had one or more of the following barriers to access this transportation. And again, if they don't have transportation, they can't get to their doctor's appointments. So these are the underserved, these are the low income, these are the veterans that don't have the ability to make these calls and get transportation. So the 9 big issues: complicated application process, just a matrix for them, or they don't have the ability to get online and do this, or over the phone. The transportation organizations are not responsive within 24 hours, weekends, after hours, holidays. So if a VA doctor says, I need to see you in tomorrow, or you need to stay another day in the hospital, these transportations can't turn that ride program around to either take the veteran the next day or take them home. So all of these are big gaps that we found, to include age restrictions, regardless of the veteran's accommodations and limitations. We have very elderly veterans, those that don't get around well. They have mobility issues, they have hearing issues, vision, sometimes cognitive memory. And with the veteran population too, we have issues around PTSD, mental and emotional challenges. And this won't be solved by a free Lyft ride or a free Uber ride or taxi ride. It's a little more nuanced and complicated than that. Limited geography and mileage by these transportation programs that we researched. They only serve ambulatory veterans unless you want to pay a lot of money for wheelchair support. And the drivers are not trained to support a person with these accommodational needs. Quite frankly, if you have hearing, vision, and mobility, if you're calling for a taxi or Uber or some kind of, local public transportation, these challenges are absolute barriers to access and for them getting the care. So you have the barriers of care on the veteran side because of their abilities. Again, this is the elderly, the disabled, the very low income veterans. And then on the other side, you have these very logistical barriers of care, like complicated application processes, being responsive, and showing up with the transportation, age restrictions, geography, et cetera. So it's kind of a twofold what we're looking at. Because of this needs assessment we did, we teamed up with another organization and did a proof of concept transportation program in 21 and 22. It was overwhelmingly successful. We had a lot of data that not only showed us that there were nuanced needs for our veterans that the current mobility programs weren't providing, but also the burden for the veteran spouse, and the caregivers that were going on. We had veterans going to dialysis 3 times a week locally within their town, and then a couple appointments, 2 or 3 appointments a month down to the VA in DC. So there are a lot of coordination touch points when you look at coordinating with the doctor, coordinating with transportation, making sure the transportation driver knows they have to wait an extra 20 minutes at the street of the veteran by their home for the veteran to get from their couch to the cab or whatever the transportation vehicle is. So we did this proof of concept with the Dulles Area Transportation Association. They were a middleman. This was COVID federal money that we used. Hugely successful. We went from 21 rides a month to over 250 rides a month within about 7-month time frame. This was great. However, this particular grant ended, in 2022. During this time that we were so successful in helping our veterans and collecting the data to understand what the needs are, what the demographics are, what regions these veterans are coming from in Northern Virginia, we found out really quick that we were going to have to find other funding sources. So we started talking with the Department of Veteran Services. This was back last administration as well with Commissioner Maxwell. He assigned a team to us to look at the transportation need, came up with the same issues. There's no one in the area doing on-demand, safe, reliable, and consistent, affordable transportation for our veterans. This year, Lieutenant Governor Winsome Sears said we absolutely needed a line item on the budget for transportation. She had no idea these issues were happening and these veterans were being marginalized. Over this past year and a half, I've been talking with Commissioner Gade, the Department of Veterans Affairs, and other agencies and basically stakeholders within this transportation arena to determine what the answer is. We have a solid proof of concept, which went from September 2021 to the end of December 2022. We provided over 1,500 rides for veterans. The average cost was about $100 for the care coordination, $100 for taxi rides. Bottom line going forward is that this is a subpopulation of every elderly and in need person here in the Virginia area. We're focused on veterans because that's our mission as a veteran nonprofit. However, what I'm proposing is that we do an extended proof of concept off of this current one that ran for about a year and build out this across Virginia and have hopefully some very proving data that shows what we're doing for our veterans and more importantly, why it's needed. We're at a critical point. The Lieutenant Governor feels this way. We've worked a lot with Rich Anderson over the year as well. The last administration and our current administration are on board with us. What I need is to know if the General Assembly and the delegates and the senators involved think it's as important as we do to put money towards an additional expanded proof of concept around $480,000 for about 12 months worth of work to see how not only it affects this veteran population and how it's needed and how these other mobility programs are not fitting the bill. I'm going to expand that out to our elderly and in-need population from there. And that's basically all I have. I would like for you to consider that. I'm happy to provide research papers, white papers that we've done over the years. I'm very academic focused when it comes to these things and finding the gaps and needs. We have a lot of evidence behind us. And again, appreciate your support. Feel free to reach out to me for further information.
So the next speakers, Rita Parrott and Laura Cooper, are not present. So we'll move to number 48, Heather Jones.
Hi, how are you? Thank you for the opportunity to speak today. My name is Heather Jones. I am the mother of a child with disabilities who has also received services from the Medicaid waivers. I'm also the Chief Operating Officer for Moms in Motion, the largest service facilitating company in the state of Virginia. And I'm here to speak with you today about the consumer-directed Medicaid waiver services rates. I'm asking for you to support a fix for the 5 consumer-directed Medicaid waiver service rates. I'm also asking that you support an amendment to the budget that would correct the rates and bring them to the 50th percentile BLS rates that were recommended by the Burns and Associates rates rebase study last year, without any of these services falling below the current 12.5%. CD services were created in 2005 to help individuals direct their own care and make their own choices.
The state did not have the capacity to administer these services themselves. Therefore, they opened it to the public partnership with private providers. Services facilitators administer CD services in order to help people find, hire, manage, train, and retrain good personal care attendants. Services facilitators help people become their own employers of record, ensuring their authorizations for services are approved, their needs are being met, they are safe in their own homes, and that their attendants are being paid properly through the fiscal agents. Since 2005, the 5 CD services have received exactly one rate increase, which was last year, and it was 12.5%, which equates to about 0.7% per year. That is not enough to keep with the minimum wage increases, inflation, cost of living increases, additional administrative burden, and so on. CD services were included along with other 30-plus DD waiver services in the recent Burns and Associates rate rebate study. And the BNA recommendation for CD services was an average rate increase of 69%, which would bring them to the 50th percentile of the BLS. CD services were then left out of the group of DD services in the last session that received the BNA recommendation of routes. I'm asking that you please support the amendment that will fix consumer-directed Medicaid waiver rates and bring them to the BNA recommended 50th percentile rates, ensuring none of them fall below the current 12.5%. I want to thank you again for your continued support for our families who receive services, and please to continue support the providers that provide these services for these families. Thank you.
The next speaker, Mary Ludwig, is not present, so we'll move to number 50, Kristen Lennox.
Thank you. Hi, I'm Kristen Lennox. I'm with Voices for Virginia's Children. We are the Commonwealth's only independent multi-issue child policy and advocacy organization. We champion public policies and legislation that achieve positive and equitable outcomes for young people. And we are delighted to be able to work and continue to work with many of you on this call. A state budget document is a reflection of our lawmakers' priorities, and while the proposed budget put forth by Governor Youngkin is a good start, there is more that our General Assembly members can do when they convene next week. The budget proposed by Governor Youngkin provides a good start for children's mental health, child welfare, and early childhood education. However, to meet the urgent needs of children and families, we will ask lawmakers to keep working on the budget. With regards to mental health, Virginia children are in a mental health crisis, with more than half of middle and high school students indicating that they feel nervous or anxious or on edge, and more than 10% of students are contemplating suicide. Governor Youngkin makes significant investments in school-based mental health, crisis service response, and attracting and retaining a mental health workforce. We hope legislative champions will keep this in the budget, as well as consider adding additional staff capacity to implement new initiatives and look to leverage Medicaid funding to sustain and grow school-based initiatives. With regards to child welfare, we are facing workforce shortages in every child-serving profession, from childcare, as you've heard already today, to education, to social work, and need to attract and retain caring professionals into these fields. The proposed budget continues efforts from the last 3 years to increase salaries, to attract and retain social services staff, but the budget did not include proposals to attract new social work staff through the child welfare stipend program or support existing staff through a training academy, which would focus on trauma-informed care. For early education, only 1 in 6 children in Virginia has access to affordable, accessible early education programs. And while the governor's budget continues expansion in early education, the $20 million proposed to expand mixed delivery grants only reaches 2 regions in the state. More is needed to expand access statewide and support parent choice in the child care subsidy program. For family economic security, too many families are feeling economic strains, with 44% of families with children in their home indicating that they are worried about paying for their usual household expenses as of this November. While an unprecedented budget surplus, lawmakers can return some revenues back to taxpayers in the form of tax relief, especially tax relief targeted to the lowest income families through the Earned Income Tax Credit or the Child Tax Credit. So families need flexible resources to provide stability to their children and families. Thank you so much for your time. Have a great rest of your day.
And the next speaker is Cheryl Binkley.
Hello?
We can hear you.
Okay, I wasn't sure since I can't see me. Good afternoon, and thank you all for both serving the rest of the winter and for being here today to listen to our litany. There are two proposed items. My name is Cheryl Binkley, and I am from Alexandria. I am a retired teacher and have, just by way of sidebar, I taught both dual enrollment and NOVA courses on campus during part of my tenure, part of my career. There are two proposals that, two proposed items in the governor's budget that I would like to speak to because they are deeply flawed. The first one is that regarding teacher bonuses and pay and the teacher shortage. In short, we will not solve the teacher shortage by paying teachers a pittance for 1 year. Pay above the national average will be required, and that's if we want our children spending their days with knowledgeable, competent, and skilled people. It's just that simple. Somehow, whether it's through SOQ funding from the state that frees up dollars at the local level, or a fully funded state level budget of teacher pay, we have to get there if we want to continue to have a great system. Second is the request for $50 million for additional $50 million for lab schools. There are two reasons that money is not needed to be there. First is the demand for actual lab schools is just not there. There were, of the $100 million appropriated during the 2022 General Assembly, only $516,000 has been applied for and approved to be spent, leaving $99 million of the original $100 million unrequested. So the governor's office's officers' insistence that we need $50 million more really doesn't hold much water. And of the other problem that is of the three applications currently approved, only one actually fits legally under the Virginia code parameters of a lab school. The governor is playing fast and loose with Virginia law and the legislature by cross-funding his charter school plans, his workforce development program, and his economic plans out of a lab school label. None of that provides positive benefits for our system, and it does not provide a cogent and cohesive programming plan. Of those three approved programs, two involve community college expansion of already existing dual enrollment programs, which I approve of. Lots of dual enrollment. I'm a former dual enrollment teacher, but that is not what a lab school is. It flies in the face of the requirements for an actual lab school. And those three approved programs, two of them involve computer coding programs for specific companies. One that wants to sell their product and one that wants us to buy a product. So coding programs are interesting, but just by way of reference, we already provide all kinds of electives for our students related to entertainment and media prep. And that's a $717 billion industry. We're looking at the governor's proposals that would cancel those electives, because electives are a zero-sum game for a student, that would cancel those electives and provide them an option for an industry that is a $4.65 billion industry. So we're downsizing our students' options by doing it this way. I'm not against coding electives. We have them available in most schools in the Commonwealth, but hiding a economic agenda within a lab school plan through this $50 million is not the way we should be going about it, and not the way we should be analyzing it. I would like to say that related to dual enrollment and electives, there are some wonderful, interesting suggestions in the current JLARC report. And thank you all for doing that work and for being thoughtful in the way you approach this. But those are the two things. We need to pay our teachers, and we don't need $50 million for coding. Thank you.
Mr. Chairman, none of the previous speakers that we skipped over because they weren't present have not returned. So she was the last speaker.
All right. Well, certainly this will come to a close with our public hearing here. It's been a great sharing experience with a lot of individuals presenting very significant and very specific proposals there. And we will take a look at those in both the House and the Senate as we're working through the budget again this year. And I do want to note that my co-chair in the Senate Finance and Appropriations Committee, Senator Janet Howell, would have been with us, but had a family medical issue that needed to be dealt with today. So we will proceed from here, and we will get our everything started and get into the budget as quickly as we can after we open the session next Wednesday. And with that, if there's nothing else, I will say that we are done, and we appreciate again everybody participating.
Thank you, Senator.